So peripherally acting alpha adrenergic blocker. So these groups of drugs we used in the treatment of high blood pressure or BPH. BPH stands for benign prostatic hyperplasia. So most common drugs we use doxazosin, PRAZOSIN, or PRAZOSIN. Another drug is called temulocin. The peripherally acting alpha adrenergic blocker like PRAZOSIN, TIAZOSIN, how they work. This medication decreases sympathetic vasoconstriction by reducing the effect of norepinephrine 8 peripheral nerve ending and resulting in vasodilation and decrease the blood pressure. And this medication are used to maintain renal blood flow, and also this medication are used to treat hypertension. And the common side and adverse effect, they can cause hypotension or orthostatic hypotension. They can cause palpitation, which lead to the reflex tachycardia, sodium and water retention, edema, weight gain, and gastrointestinal upset, means nausea, diarrhea, and vomiting. Also, they can cause dizziness or dryness and dry mouth. So easy way to remember, they can cause hypotension or they can cause palpitation, which lead to the tachycardia, and sodium and water retention. When water retention edema develop, when water retention and edema develop, automatically body gain weight. Gastrointestinal upset is common, like nausea, vomiting, and diarrhea. Patient have a drowsiness or dizziness and dry mouth, and also nasal congestion. So if our patient have this kind of side effect, it is important to monitor. So nursing implication, particularly administer the dose. It is good to tell your patient, admit the dose at the bedtime. Also monitor the blood pressure or assess for edema, and educate to avoid operating heavy machineries or driving a car. Let me read it. Monitor the vital sign because it can cause hypotension, can cause tachycardia, palpitation. Monitor food and retention and edema. Instruct the client to change the position slowly because of postural hypertension. And also instruct the client how to monitor blood pressure so they can manage by themselves. And also instruct the client decrease the salt intake, and instruct the client to avoid over-the-counter medication if they take doxazosin PRAZOSIN, TERAZOSIN, or temlolocin. What next? Next group of drugs is called centrally acting sympatholytic or adrenergic blocker. Particularly, we called alpha agonist. So these groups of drugs decrease the effect of dopamine on the blood pressure. The most common drugs we use, clonidine or methyl dopa, most commonly used. They are alpha 1 blocker, but alpha 2 blockers or alpha 2 receptor blockers are valsartan, losartan. So these groups of drugs, centrally acting sympatholytic, and stimulate alpha receptor in central nervous system to inhibit vasoconstriction, thus reducing peripheral resistance, and used to treat hypertension or contraindicated in impaired liver function. So what are the side effects or adverse effects? The clonidine or methyl dopa have a common side effect: postural hypotension, impotency, drowsiness, and dry mouth. So clonidine, the drug's name here is clonidine. Other drugs we use, and it is called clozapine. So clozapine, antipsychotic, but clonidine, alpha agonist, antihypertensive. And next here, common side effect, sodium and water retention, as like as alpha 1 receptor blocker. They also can sodium water retention. If water retention lead to edema. An easy way to remember these groups of drugs by D: drowsiness, dizziness, dry mouth, right? And hypotension, as like as alpha receptor blocker, they also cause hypotension, postural hypotension, or bradycardia. But alpha 1 receptor blocker, doxazosin, PRAZOSIN, they can cause tachycardia. And these groups of drugs has a adverse effect, they can cause impotency. So if the patient is young adult, it is good not to give. And also depression. So it is good to admit the dose at the bedtime and monitor the blood pressure and assess the edema. But next, it is important to monitor vital signs. Instruct the client not to discontinue medication because abrupt withdrawal can cause severe rebound hypertension. So it is good to stop slowly. Also important to monitor liver function. And it is also important to educate your patient to avoid driving, avoid operating machineries after taking these groups of drugs.